Think back to the last time you saw someone stumbling down the street, barely able to move, looking like they were lost in a haze. Was it in an alley downtown beneath a highway, or maybe right in the middle of the city? It wasn't always this way. Not long ago, these sights were uncommon. Today, they're a part of daily life in cities across America, and sadly, most people have become numb to it.
The so-called heroin, and on the heroin, there's the so-called the stuff they have now. You know what I mean?
Fentanyl and meth are transforming the landscape of our streets. They've stopped being just drugs. They're now a chilling symbol of something much deeper: pain, hopelessness, and a country that seems to have forgotten how to care for its most vulnerable. This issue isn't limited to addiction. It's intertwined with homelessness, mental health struggles, and the collapse of support systems that once kept us connected.
Can't say about this neighborhood though, man. Actually, it wasn't a good neighborhood at one time. You know what I mean? But it's like damn drugs destroyed this shit, man.
At the heart of it all is what happens when we turn a blind eye to a crisis for far too long. In this video, we'll dive into the devastation caused by fentanyl and meth, explore why so many homeless people in America turn to these substances, and examine what, if anything, is being done to address the crisis. Remember, this video is for educational purposes only, not to glorify any harmful action. Fentanyl, a synthetic opioid that is up to 50 times stronger than heroin, initially entered the medical field as a powerful painkiller for cancer patients. However, over the past decade, illicit fentanyl, often trafficked across the southern border and sourced from Chinese precursor chemicals, has surged across American streets. The Centers for Disease Control and Prevention, CDC, reported over 70,000 fentanyl-related overdose deaths in 2023 alone, marking the deadliest drug epidemic in U.S. history.
July 4th, so like the 17th, I think it was, he found him underneath the bridge and he overdosed, and then like he passed away almost a year ago, and then about a month after he passed away, his cousin ended up passing away. So like my heart breaks for his family. Like right now, this stuff that I'm getting, it breaks me out in hives. Like my whole, wherever I go, like from my fingertips to my elbow will swell up and I'll have hives. Or like my leg from my knee to my ankle, like hives.
At the same time, methamphetamine, particularly in its crystal form, has staged a dramatic comeback. While fentanyl's rise started in the East, meth's resurgence has been most noticeable in the West and Midwest. According to the Drug Enforcement Administration, DEA, meth today is purer, cheaper, and more accessible than ever. Mexican cartels have industrialized its production, flooding the market with high-potency batches that sidestep traditional production limits. What makes this crisis even more alarming is the dangerous mix of fentanyl and methamphetamine known as goofballs. This combination is becoming increasingly popular among users, looking for both a rush of euphoria and a boost of energy, often leading to fatal overdoses. The homeless population has been particularly affected, trapped in a vicious cycle of addiction, mental breakdowns, and death on the streets. This dual crisis of fentanyl and meth isn't just a public health catastrophe, it's changing the landscape of American cities. Once vibrant streets, filled with workers and students, are now lined with tents, discarded syringes, and people lost in addiction. For many communities, there's no clear solution in sight. Local governments are overwhelmed, law enforcement stretched thin, and families helplessly watch loved ones fall deeper into this deadly spiral. To truly understand the transformation of American streets, we have to trace the origins of the crisis back to two substances, fentanyl and methamphetamine. These drugs didn't emerge simultaneously or in the same way, but together they have created the most deadly drug wave in recent U.S. history. Fentanyl, originally developed in the 1962nd as a prescription painkiller, was intended for use in hospitals, primarily for cancer patients or during surgery. Its effectiveness in treating severe pain made it a valuable tool in medical settings. However, in the early 2002, pharmaceutical fentanyl, found in patches and lozenges like Duragesic and Actic, began to be overprescribed, particularly following the opioid crisis triggered by drugs such as OxyContin. By 2010, when stricter regulations were imposed on legal opioids, illicit manufacturers stepped in to meet the demand. Today, most fentanyl on the streets is made illegally in labs, often in Mexico, with precursor chemicals coming from China. What makes fentanyl so lethal is its potency. A dose as small as 2 milligrams, equivalent to a few grains of salt, can be deadly. It's cheap, easy to produce, and incredibly potent, which has led to its dominance in the overdose crisis. In fact, the CDC reported in 2023 that synthetic opioids, primarily fentanyl, were responsible for nearly 75% of all drug overdose deaths, accounting for over 70,000 fatalities. In parallel, methamphetamine has evolved into a major player in the crisis. What started as a substance manufactured in small, hidden labs across the U.S. in the 1992nd is now largely produced by Mexican cartels on an industrial scale. Today's meth is nearly pure, with purity levels often reaching 90–100%, compared to the 30–40% purity of earlier years. Even more alarming is its low cost. A single dose of meth can be cheaper than a cup of coffee, making it readily accessible to anyone, even those living on the street. While meth doesn't typically cause fatal overdoses like fentanyl, it wreaks havoc on the brain over time, leading to paranoia, hallucinations, and erratic behavior. When combined with fentanyl in a mixture known as a goofball, users often feel as though they're in control, even as they continue to spiral into greater harm. This shift in drug use didn't happen by chance. It's the result of years of changing drug demands, aggressive trafficking networks, and gaps in border enforcement. Now, in many urban areas, fentanyl and meth dominate both the drug market and the daily lives of those caught in the web of addiction. The physical and psychological effects of fentanyl and meth have transformed the streets of America, shaping a new kind of addiction that's both difficult to escape and deeply ingrained. These substances, while different in their impact, combine to form a vicious cycle that is nearly impossible to break. Fentanyl, a synthetic opioid, works by attaching itself to the brain's opioid receptors, which control pain and emotions. It takes mere seconds after entering the body for fentanyl to block pain and induce a powerful feeling of euphoria. However, this effect doesn't last long, pushing users to chase the high with more frequent doses. Over time, the body develops a tolerance, and larger amounts are needed to achieve the same effect. This creates a rapid dependency, often forming within just days. What sets fentanyl apart from other opioids is its speed. It's incredibly potent, with studies showing it's up to 50 times stronger than heroin and 100 times stronger than morphine. Even small errors in dosage can lead to severe consequences like unconsciousness or respiratory failure. Despite these risks, many users, especially those living on the streets, continue to use fentanyl, not just to feel good, but to stave off the painful symptoms of withdrawal. Methamphetamine, on the other hand, stimulates the brain by increasing dopamine, the chemical responsible for feelings of pleasure, motivation, and energy. The result is an intense burst of energy and heightened alertness, making meth particularly appealing to individuals in high-stress situations, like those living outdoors. However, chronic use of meth takes a toll on the brain. Over time, it leads to anxiety, aggression, and even paranoia or hallucinations. A 2022 report from the Substance Abuse and Mental Health Services Administration, SAMHSA, highlighted the long-term cognitive effects, including memory loss and impaired decision-making. While the physical signs of meth addiction may be visible, it's the neurological damage that leaves a lasting impact. When combined with fentanyl, these two drugs create a cycle of mental instability that plays out in the streets of major cities, where many homeless individuals are caught in this pattern without access to proper health care, nutrition, or rehabilitation. It's easy to look at someone on the street using drugs and think they just made bad decisions. But the truth is much more complicated. So many people who are homeless in America end up turning to fentanyl or meth, and it often starts with pain, whether it's physical, emotional, or social. Life without stable shelter is brutal. Cold nights, constant hunger, illness, and stress take a toll on anyone. Fentanyl, with its numbing effect, offers temporary relief from that relentless pain. For some, it's a way to escape their harsh reality, even if just for a little while. Meth, on the other hand, is a different kind of escape. It keeps people awake when sleeping outside is dangerous, and it gives them energy when there's little food to go around. It's not about seeking a high, it's about survival. But it's not just about coping, it's about access. These drugs are cheap, potent, and readily available on the streets. In many cases, getting a hit of fentanyl is easier than finding a bed in a shelter. So many of these individuals don't start using because they want to, they start because they feel like they have no other choice. Can we really expect someone with no home, no food, and no hope to stay clean? When basic needs are unmet, addiction isn't just a personal flaw, it's a sign of a system that's failing them. For many homeless individuals, drugs are the only way to keep going in a world that has abandoned them. 5. America's urban epicenters, the collision of fentanyl, meth, and homelessness in major cities. New York City, once seen as the beacon of American ambition and progress, is now grappling with a crisis that runs deeper than ever before. As of 2024, more than 88,000 individuals are either in the shelter system or living unsheltered, a staggering number that marks the highest point since the Great Depression. While the city has long struggled with homelessness, a more harrowing layer of suffering has emerged with the surge of fentanyl and methamphetamine. The New York City Department of Health reported that in 2023, over 3,000 people died from drug overdoses, with 85% of these deaths linked to fentanyl. In boroughs like the Bronx and parts of Manhattan, the intersection of unstable housing, deep poverty, and widespread drug access has led to clusters of people stuck in a vicious cycle, constantly moving between shelters, emergency rooms, and the streets. Here, the sight of individuals clearly under the influence, barefoot, dozing off on curbs, or pacing aimlessly, has become disturbingly commonplace. This isn't just a housing crisis or a drug epidemic. It's a complex, intertwined catastrophe that reveals how broken the system has become. For too many, the only option is temporary shelter, with little hope of a real way out. In Philadelphia, the situation is no less dire. The Kensington neighborhood, often described as the largest open-air drug market on the East Coast, stands as a stark representation of what has gone wrong in America's approach to homelessness. With more than 5,000 unsheltered people in the city in 2023, the epidemic is visibly concentrated in Kensington, where outreach teams estimate that at least 700 people live in abandoned buildings under train tracks or on the streets themselves. The situation has earned this neighborhood the nickname Zombieland due to the number of people heavily sedated by fentanyl, meth, and increasingly xylazine, a powerful tranquilizer. As of 2023, a shocking 94% of drug samples in the area contain fentanyl, and the widespread use of methamphetamine only intensifies the mental health breakdowns and erratic behaviors among the homeless population. Despite pilot programs offering housing solutions and supervised consumption sites, city resources are stretched thin, and political squabbles prevent more widespread action. Meanwhile, Los Angeles is facing an equally overwhelming crisis. With over 75,000 unhoused individuals across Los Angeles County in 2024, representing a 10% increase from the year before, the problem continues to grow, with no sign of slowing. Skid Row, a 50-block stretch in downtown LA, remains the heart of the city's homelessness epidemic. Here, methamphetamine is the dominant drug, with outreach workers estimating that more than 60% of street residents regularly use meth, often mixing it with fentanyl. Overdose deaths across the county surged to over 2,400 in 2023, and nearly 75% of those deaths involve fentanyl. As encampments now spill over onto freeway off-ramps, sidewalks, and public parks, the city's efforts to tackle the crisis, billions of dollars invested in housing and addiction services, have been delayed by bureaucracy and zoning disputes. In all three cities, New York, Philadelphia, and Los Angeles, a chilling pattern repeats. Rising drug-related deaths, visible addiction on the streets, and increasing numbers of people without homes point to a deeper, more fundamental failure. What will it take to break this unrelenting cycle? How much longer can we, as a society, continue to turn a blind eye to the harsh reality of homelessness in America before the damage becomes irreversible? The fentanyl and methamphetamine crisis continues to ravage public spaces and overwhelm communities, forcing the U.S. government to respond with both law enforcement and public health strategies aimed at reducing harm. While controversial, harm reduction policies are gaining support in many states, especially in areas hardest hit by overdose deaths and homelessness. One of the most widely used strategies is distributing clean syringes and fentanyl test strips for free. Cities like San Francisco, New York, and Seattle have implemented needle exchange programs to curb the spread of diseases such as HIV and hepatitis C, which are common when people share needles. These programs aren't designed to encourage drug use, but to minimize the associated health risks. Public health experts argue that while we can't stop drug use entirely, providing safer tools is a step toward protecting individuals from more harm. Another key initiative is the establishment of supervised consumption sites. Although still illegal at the federal level, some cities have allowed clinics where people can use pre-obtained drugs under the supervision of trained staff. These clinics, equipped with naloxone, aim to prevent fatal overdoses. According to a 2022 report from the American Journal of Preventive Medicine, no fatal overdoses have been recorded at legal supervised sites in the US and Canada. However, these policies are not without criticism. Some argue that they normalize drug use or send the wrong message to the public. But in places where overdose deaths are at historic highs, cities are choosing to save lives first and debate the politics later. After all, when lives are at stake, isn't saving them the priority? These harm reduction strategies mark a shift from punishment to prevention. While they can't fix homelessness or addiction alone, they're an important step toward reducing the daily suffering of countless homeless Americans still fighting for a second chance. What we're witnessing on America's streets is a crisis that we can't allow to continue. The widespread use of fentanyl and meth, the tragic sight of people wasting away on sidewalks, and the silence from leadership demand urgent action. This isn't compassion, it's neglect disguised as tolerance. We can't continue to excuse inaction under the guise of empathy. Cities that allow addiction to unfold publicly without intervention are failing their citizens. Letting people destroy themselves while claiming freedom of choice isn't progressive, it's abandonment. Harm reduction can save lives temporarily, but without proper rehabilitation, permanent housing, and mental health care, we're only prolonging suffering. The streets should not be places where pain is ignored, where despair is tolerated, or where lawlessness becomes policy. We must demand more, not only from the government, but from ourselves. This video isn't here to exploit pain, it's here to expose a harsh reality. Our goal is education, not sensationalism. Because until we confront the truth, nothing will change for the homeless or for the communities they inhabit. Conclusion: a nation standing at a crossroads. America stands at a crossroads with its streets, whether in New York, Philadelphia, or Los Angeles, speaking volumes about the ongoing crisis. The toll of fentanyl and meth addiction isn't just felt by individuals but entire communities, and the explosion of homelessness has only made things worse. This isn't about personal failure. It's the consequence of broken systems, political inaction, and policies that tackle the symptoms but never the root causes. The homeless deserve more than temporary shelters and harm reduction programs. They deserve hope, stability, and a future. So, how many more lives need to be lost before we decide to take meaningful action? If this video moved you, don't stay silent. Share it, start discussions, ask the hard questions. Because ignoring the problem is a choice, and choosing to care might be the only way to fix it.